Welcome and hoş geldiniz. I'm Hana Onat, Communications Manager at Columbia Global Centers Istanbul, and your MC for today's event. As we are providing simultaneous translation for today's event, I will say a few words first in English about that, Turkish, and then continue the program in English. Welcome again to today's event, Photography and Community Participatory Health Research in Forced Migration Settings, which is part of Columbia University's REACH project. Today, we are pleased to have speakers from Taiwan, Turkey, and the US representing the project. In the first half of our webinar, we will hear from representatives from all of our partner organizations, which will then be followed by a panel discussion. Just one housekeeping item before we get started. There will be simultaneous translation into English and Turkish, so if you would like to listen to the English translation when someone is speaking in Turkish, go to the interpretation icon at the bottom right corner of the screen and select the English option. And for those who want to listen in Turkish, choose the Korean option. Thank you to our translators today, Ceren Bektaş and Ceylan Gürman. In addition, please send your questions in either English or Turkish for the panelists via the Q&A box. We have also shared these instructions in the chat box. So let's get to our speakers. First, we will hear from İpek Cem Taha, Director of Columbia Global Centers Istanbul. İpek, the floor is yours.
Thank you, Hannah, for that introduction. Good afternoon and welcome, everyone. I'm İpek Cem Taha, the Director of Columbia's Global Center in Istanbul. We are one of 9 centers across the globe established by Columbia University, and our aim is to connect the local with the global and to create opportunities for shared learning and to deepen the nature of the global dialogue. Today, we're delighted to host this online panel and photography exhibition, a culmination of a year's worth of work by many people who are sitting around the table and who are not sitting around the table right now. Some of them you'll get to meet. The work of the REACH project. The REACH project was birthed at the Center for Sustainable Development at the Earth Institute at Columbia University and has grown hand in hand with our center and our 2 local partners, Istanbul University and BIRIS Association. This project is generously supported by Columbia's President's Global Innovation Fund, as well as supported by the International Cooperation and Development Fund of Taiwan. Many, many thanks. We had hoped that this event would take place in Istanbul and we would get to see all of you in person, and that was to happen in May. But as you know, with the pandemic at hand, we are now bringing it to you virtually, and we're so happy that we can bring both the exhibit and our work to a more global audience today digitally. Thank you.
Thank you. And next we will hear from Dr. Yanis Ben Amor, who is the Executive Director of the Center for Sustainable Development at the Earth Institute at Columbia University.
Thank you so much, Hannah. Hello, everyone. So as Hannah just introduced me, my name is Yanis Ben Amor, and I am the Executive Director of the Center for Sustainable Development at Columbia University. The Center for Sustainable Development was created in 2016, and our goal is to help develop innovative solutions to reach the Sustainable Development Goals by 2030. So to that end, in 2019, we launched the REACH project, Refugees, Act, and Communicate for Health, because we believe that the SDGs will not be reached by 2030 unless we help mitigate the current refugee and migrant crisis. So the goal of the REACH project is to develop a digital solution to provide health information and facilitate healthcare access to refugees, migrants, and young locals in Turkey and Lebanon. You'll hear more about that in just a few moments, but today's event will focus exclusively on Turkey. This project would not have been possible, like Ipek just mentioned, without the fantastic partnership of so many collaborators. And I want to thank them all today for their invaluable contribution. At the end of the event, I'll have the opportunity to tell you a little bit more about future ideas and research initiatives of the REACH project. But for now, let me wish you all a great event, and thank you again for joining us.
Thank you. And next we will hear from Özlem Mumcuoğlu, Chairwoman of Biriz Association.
Hello, welcome everyone. This project, being part of this project makes us very happy. Being a partner makes us very happy. For us, there are always projects that start and that end, but I always say none of them are endings. They're all new beginnings. And this REACH project is also a new beginning. We had been part of it for a long time, and being able to do this despite the pandemic is great. I would like to talk about Biriz a little bit. We were established in 2013. We have psychologists, education specialists, public health specialists, and we are based in Istanbul, but we worked in many areas of Turkey, Samsun, Urfa, and we are focusing on mental health to serve social peace, and we are working with women, children, and refugees. And when we talk about social peace, there are a lot of aspects to it. We worked in schools, in hospitals, we worked with imams, we worked with the police department, and we worked with psychologists to basically heal the healers. So we are trying to support the people in the field, basically. I'll try to speak slower for the interpreters. And at the point we have reached, for the last 3 years, we have been working in the refugee area. I'd like to talk about our project Yan Yana, side by side. We supported teachers and psychologists, teachers who had Syrian students in their classrooms. And also, we worked with psychologists who work in various NGOs. And we prepared a big box game which Turkish and Syrian children could play together, a box game that would mitigate discrimination. And it had toys and books integrated to it as well. It was a big project. And we completed this project yesterday, and we just had the press conference actually. And in this second project, we focused on the fact that all the people who are working in the field are basically suffering from secondary trauma, and this is not easy to overcome. So we established therapy groups and training groups, conducted webinars, and we had meetings. At the beginning, of course, we were physically together. We would sing together, we would eat together, and we would exchange our common problems. And we wanted to basically create some peer support, trying to get rid of all that is accumulating inside of us. And with the REACH project, we really want to thank the Columbia Global Center because we are working with young people. Again, we have 2 public health specialists. Two of them are about to complete their PhDs. So it is great to be part of a project that focuses on public health. And we also worked with prisons. I forgot to talk about that. We worked with the mothers who were in prison with their children, and also with the officials at the prisons. That's all from me. Thank you.
Thank you. And next we will hear from Professor Selma Karabey from Istanbul University's Faculty of Medicine in the Department of Public Health.
Thank you, Hannah. I would also like to say hello to all the participants, and I would like to deliver the greetings of the Istanbul University presidency. Istanbul University has more than 100,000 students. Its population is more than many districts, and we are very much intertwined with the youth, and we have around 7,500 international students, and we know that little interventions made during teenage times can create very valuable results in adult life. So that's why we believe that every step that is taken is very valuable. Institutionally, as the Istanbul University, we are putting effort into this as well, and we also believe it is very valuable to support other efforts like REACH in this sense. I wholeheartedly believe that the outputs of REACH will contribute to Istanbul University, to our more than 100,000 students, and I believe that we will also be supporting REACH in reaching its targets. I hope we will come together again with great results in the future as well. And I would like to greet all of you. Thank you.
Thank you so much. And next we will hear from Ambassador Yasser Chang, who is from the Taipei Economic and Cultural Mission in Ankara, Turkey.
My dear colleagues from ICDF, distinguished friends, Ipek Jem Daha Hanım, Dr. Amu of CST, Oznem Hanım of Birlis, Professor Dr. Selma Hojam, thank you for giving me this floor. I always think a luckiest person is someone who can work hard to earn his or her own life, and at the same time, who can contribute something for charity and humanity. I believe that all of you are the luckiest people. I admire you and envy you. You are now doing something that can benefit so many people in need. And we are looking forward to seeing more concrete results from your project. I would also like to take this opportunity to promote Taiwan, ICDF, and my mission. Over the past few years, Taiwan continuously try its best to contribute something for the Syrian brother and sister in Turkey. Even Taiwan is 80,000 kilometers far away from Turkey. And we have doing something. For example, we built a school in Rehanle, Hatay for our Syrian young generation. And one of our NGO established a school accommodating 3,000 Syrian students in Sudan, Ghazi, Istanbul. And even 2 weeks ago, we contribute 10,000 medical masks and medical equipment for Syrian in Idlib. And at this very moment, a construction of a community center for Syrian is going on in Rehanle. So I invite all of you to visit our school and community center. And Taiwan will help and can help our Syrian brother and sister, and Taiwan is helping. Last but not least, I want to remind you and myself, when we are working very hard to help a Syrian brother and sister, we should not forget and ask who caused this refugee tragedy, who caused this pandemic spreading in the world. When the world shouting Black Lives Matter, who shout refugee life matters? We should not forget to seek justice from the authoritarian regime. Now, I thank you very much.
Thank you, Ambassador, for your comments. As our last speaker, we will hear from Timothy Shang, Secretary General of Taiwan International Cooperation and Development Fund, who is unfortunately unable to be with us today and sent a recorded message, so let's watch that now.
Dear participants, ladies and gentlemen, on behalf of the Taiwan International Cooperation and Development Fund, it is my great honor to deliver the opening remarks at today's event. Firstly, I would like to thank Center of Sustainable Development of Columbia University and all the local partners for your efforts in assisting the project of Refugee Act and Communicate for Health. This project is the very first project that TaiwanICDF cooperated with Columbia University. Also, it is our first try to develop a mobile health application in humanitarian context. We believe using technology will greatly improve effectiveness of aid, given the continuing high demand of humanitarian assistance with expanding costs. Most importantly, we hope this mHealth application developed under this project will bring a real change in improving refugee access to healthcare service and literacy. The barriers caused by languages, geographic accessibility, or cultural and social norms will no longer hinder anyone in need. This online exhibit plans to depict the challenges situation faced by the refugees and local communities in Turkey. Due to the COVID-19 pandemic, unfortunately, we cannot have our event conducted in physical way as it was originally planned. However, through this virtual event, it could reach out to more people who care about refugees' situation and health issue. We also would like to take this opportunity to call for international community's attention because amid the pandemic, refugees are even more vulnerable than ever. Lastly, I would like to close my remarks by wishing this event a great success. TaiwanICDF will continue to work with our partners to help people in need, as we firmly believe no one should be left behind. Thank you very much.
Thank you to all of the speakers in the first half of our webinar. I really can feel the passion for the project. So now we will move on to the panel discussion. Now I give the floor to Professor Selma Karabey, who will moderate today's panel.
Thank you very much. Ladies and gentlemen, in this panel session, we will be together with our four valuable speakers who are present at this webinar, but we also have yet another valuable colleague or a teammate, let's say, who wasn't able to join us, Laleper Aypek. And all the visuals, the photographs that you will see today are thanks to her great efforts, but because of some hurdles, she wasn't able to join us today, but she will be represented here thanks to her photographs. So this project was in a way able to anticipate the pandemic because we were able to activate the digital field so that the young people would have access to healthcare services. So this project was developed for that purpose, by anticipating the pandemic, because we've seen how important technology was to, save our lives during this pandemic. So this project is now, during this special period, becoming more important. So I don't want to take much of your time, but I would like to talk about the results of the Photovoice part of this project, and we will be sharing with you the photographs that were taken under that scope. So our first speaker will be Associate Professor Özge Karadağ Çaman. Özge has been working with young people for long years, especially with vulnerable groups, and she was coordinator and the creator of this project. And she also was able to mobilize so many institutions from Columbia University, and she was able to bring us together here in Istanbul. So Özge will be talking about the methodology of this project, and she will also show us some photographs and videos that were taken during the project. By the way, I will present all the speakers now so that they will be giving the floor to one another in order to not to lose time. So after Özge, we will have clinical psychologist İnanç Sümbüloğlu who will take the floor. She was the leader of the research team of Photovoice, and She will share with you short findings of the Photovoice, but she will also talk about her own experience to explain us how she experienced this process. And then, of course, as this is a youth project carried out by the young people with the young people, we will hear from our young colleagues who are a must for this project. Yes, this project was for the health of the refugee youth, but it was also aiming to work on the health of the local youth. So from Turkey, we had representatives of young people from Turkey. So we will have Damla Ceyhan, who is a young researcher in our undergraduate department. She will talk about the project. And then we will hear from İlyas Celal, again from the youth team of the project. So with these words, I will hand over to Özge immediately. Okay, thank you, Professor Selma. Maybe I can start with my presentation. Very briefly, I will talk about what kind of a project the REACH project is. I have a couple of slides to show you, and then we will talk about the Photovoice research methodology, which is our main topic, and I will try to resume in 5 minutes, and then we will watch the videos together. So the REACH project is a project for using technology to increase health literacy and healthcare access for refugees in Turkey. Next slide, please. The aim of this project is to bridge the gap in health literacy and healthcare access among refugee and local youth via digital health technologies in Turkey. Next slide, please. Using a community-based participatory action research, REACH aims to assess the impact of information and communication technologies on promoting young people's health and to contribute to the limited scientific literature on ICT interventions for health. We have been working with the youth groups since the beginning of this project, and we have worked together with them. So we wanted to make the research, and we wanted to come up with with scientific evidence, as I said. So what about our methodology? Well, with a strong adult-youth partnership, we wanted to bring together the relevant stakeholders through meetings. Maybe you are hearing some voice in the background. I'm sorry for that, says the speaker. So a mixed methods baseline study with young people, health care service providers, and health policy makers was used. Next slide, please. Based on this research, this mixed method, whereby we use the Photovoice method, and we also had all these quantitative meetings with the decision makers, and we were also able to reach out to refugee youth and carried out a survey, and we developed an mHealth, a mobile health application, which was one of the main targets of the project. And currently, we are still working on the content of this mobile health application. Of course, we organized photo exhibitions, or we wanted to organize photo exhibitions and panels. We wish we were able to do them physically in Istanbul, but of course, under existing conditions, we were able to put all these things in a digital platform. Of course, production of policy documents and conference papers was also another topic for the last phase of the project. Let's continue with the Photovoice method. Well, this was developed in the early 1990s by a public health expert. And it is a research method designed to empower members of vulnerable groups by giving them a chance to tell their stories and have their voices heard. Here, the participants work on the research topic, whatever it is. They take photographs of their everyday realities concerning the research topic, and then they participate in discussion groups about these photographs and what they mean for them. Just like focus group meetings, we put the photographs on the slides and we talk about the meanings of these photographs. We talk about their problems and their solutions for these problems. So this is like a group discussion. And in the last phase, the policymakers, health planners, and community leaders are reached out to create change. So we reach out to these leaders for advocacy purposes. So the Photovoice method directly aims at change. It's not only about research and sharing the findings of the research, but it is also about coming up with advocacy together with the research group in order to create change. So in the methodology that we used during January-February 2020, right at that moment when we started to see the impact of the pandemic, we were able to conclude the first phase in Istanbul. We had 4 youth groups composed of about 8 to 10 people, sometimes up to 12 young people. So in total, we had 40 young people aged between 15 to 24 years. And we wanted to make sure that these were refugee children and local youth, so we wanted them to work together. That's why we had 31 refugee and 9 local youth from Istanbul University, Cerrahpaşa Faculty of Medicine, and from Koç University. We had the chance to work together with these young people from these institutions. We had 27 male and 13 female participants. Next slide, please. Yes, as I have said, in the methodology, we created groups of 8 to 10 people with the young people to explain them what kind of research this was. We explained them the Photovoice methodology. We explained them what kind of photos they can take. And as they can take these photos, what were the ethical things to take into consideration? We discussed together in the group meetings all these things. Next slide, please. And yes, brainstorming. We had a brainstorming activity about the problems and the methodology. Of course, our aim with the Photovoice was to see the problems in terms of having access to healthcare services, and we were trying to see how we can make use of digital technologies in order to avoid these problems. So we had discussions on these topics. Next slide, please. Then young people, they went out in the field, sometimes in groups, they worked together. Laleper is there from Koç University. She was assisting us, and together with the groups, they spent very nice time in Istanbul taking great pictures. Next slide. And then, as I have explained, as it was the case in it is the case in focus group meetings, we went through these photos to talk about what they mean for these young people. Of course, Miss İnanç, she will be talking about these experiences in a minute, because she was the moderator, the facilitator of these discussion groups. Next slide. Yes, again, here we are talking about the photos. And we had different centers, and İnanç will explain in a while. After the photo shoots, we had group discussions, and here you see another photo of that. Another group. Next one. Yes, this is group 4. I think this is the end of my presentation. Thank you. And of course, İnanç, she will be talking about all these experiences in her speech. But before we continue with her, maybe we can see the photos taken by all the young people together with Professor Laleper, and we have some videos made out of those photographs, and we also have some interviews with the young people taken during the project. First video. Thank you so much. I wish the video quality would be better, but I think technically speaking, it's very difficult to do that. I wish we were able to read the words better, because there were some sentences by Aslı Erdoğan next to the photos. But all the videos that we are showing today can be watched through the project website. So they will be available on the project website. So with that, let's continue with the next video. The next video is going to be a compilation of some of the interviews made during this project. Well, they are shortened versions of the interviews. Because of timing, we had to shorten them. We had interviews conducted with 27 young people, but we will be watching only 3 of these interviews today. But as I have said, all the videos will be available on the website. So if you want to watch all the videos, you can do that through the website.
عشان الفيديو أنا كنت بسوريا وتضررت كتير وجيت لهون كملت دراستي درست وتعلمت كتير شغلات وبدي إنه يصير شيء كبير بالمستقبل. مشان هيك بدي أكمل دراستي هون كمواطن بعيش بهالدولة لأنه أمي كانت تركية وأنا جيت لهون صرت تركي وتجنست. بدي أكمل لغتي ويصير معي كل شيء حلو.
المستقبل بالنسبة إلي شوي مجهول، يمكن أفضل وين أوروبا شوي سوريا.
The future for me, maybe to find another hope, to find another place, safe place like a Syrian. We don't find any safe place in this planet. Up to our destiny, I don't know. The war is everywhere. The race everywhere. I hope in my future to become a captain. I don't know why. It's my children hope.
وانا حلمي يعني انه اكون شو اسمه مدرس. بس تفضل شوي.
As I have said, this video will also be available on our website. The video containing the interviews with 27 young people. It will be available on the website. So I would like to thank Professor Lale Per and all the young people who participated. So the last video will be about the group discussions that we conducted within the framework of the Photovoice project. We have selected a couple of photos from every single young person, and also the direct feedback or words of the young people that they uttered to comment on the photos. Let's watch. I don't know if everybody was able to read the sentences because maybe they were not clear enough, but we had in English, Turkish, and Arabic, in 3 languages, the statements, the sentences of the young people. Maybe you weren't able to read them all clearly, but as I have said, all the videos will be available on our website. And the photos make even much more sense when coupled with the meanings attributed to them by the young people with their own sentences. So during the creation of these videos, Batu Tez Yüksel and Reha Çaman helped us a lot. So we would like to thank them for their help and contribution. So with these words, I would like to give the floor to Ms. İnanç to share her experience in this process. Thank you. Thank you, Özge. I hope you can hear me all clearly. First of all, I would like to thank you so much. It was very fun and useful for me to take a look back and to take a look at the findings of the project. So I would like to thank all the young people for being our teammates in this REACH project, for setting forth on this journey for us. It was also a very educational and enriching experience for me. So that's why I would like to start with a photo from the first phases of the project. This is a text written by Aslı Erdoğan in one of the Photovoice meetings, the second meeting. We actually saw the slide of this text. It's about setting forth on a journey. So in the group we had Syrian young people and Turkish young people, and the photographer Lale Aytekin, who helped us in this project. She was attending our meeting for the first time ever. That was a very, very good meeting. We had a lot of conversations. We talked about literature, photography, the experience of being a refugee, migrant. We talked about youth. And last but not least, we talked about the tools of REACH and how to use them from an aesthetic distance. And at the end of this meeting, young people exchanged their phone numbers, and during that week, they went out to the streets of Istanbul, and they had a deal to go out together on the streets and take photos. And Özge already shared with you in the previous videos the photos that they have taken that day. So this project has a very important side. The photo voice is a very important pillar with a strong voice. That was my dream for long years. I wanted to see how I could bring together science and art, and scientists and artists. For long years I've been thinking about this, and REACH project thankfully helped me in this. So students of Lale Aytek, and with the help of the Syrian young people, we were able to use a photo voice technique, which is a scientific research technique, and we also intersected it with art. So it helped us take an aesthetic stance, and that was very valuable for that reason. Again, it was shared in the previous video, but during the Photo Voice group discussions, 2 community centers really helped us a lot. The Dolapdere Community Center of the Association of Solidarity with Migrants and Refugees helped us a lot. And Biriz Association also created a safe space for us to get together with the refugee youth. And we had 40 young people, mainly male, because unfortunately it's still not very easy to reach out to the Syrian women, but we had a lot of opportunities to have conversations with these 40 young people, and we had very friendly conversations. Sometimes we had language barriers, and when we had the language barriers, could be useful. We tried to see if we could draw instead of speaking. So the 40 people, including the project team, really made great efforts. So let's talk about the outcomes. So in terms of health literacy and access to health, we were discussing these topics, but we also had some subtopics, new subtopics that we discussed, and I hope this will be converted into content that will facilitate the lives of the young people, both for the project participants and their peers. We want to have this digital health technology to make life easier for them. So in the project discussions, we had 3 topics that we discussed. We discussed physical health, psychological health, and social health. So under these three topics, we had a lot of sub-topics that we discussed. Let's see what they were. Of course, when it comes to physical health, we discussed a lot about sleep. We talked about the fact that we don't have enough time to sleep because of other activities. We talked about hookah as a cultural habit and smoking. We said it was very widespread. And then we talked about screen and smartphone addiction, and we talked about bodybuilding, the use of protein powder for that. And they said their peers, people around them were impacted by this. Then young people talked about fast food and the unhealthy implications of that. We talked about reproductive health or pimples that are not written on the slide. So in terms of physical health, it was very clear that the young people needed tools to guide them and also the information to guide them. So when it comes to social health, again, the results were converted into a 13-minute video, and we hope to make a film out of it later on. We talk about the concerns for the future of the Syrian children, young people, I'm sorry. We have seen it from the Photovoice photos. One of the sub-messages was the uncertainty of the future and this identity of being a migrant, not having an ID in Turkey, and in terms of having access to healthcare services, you face a lot of problems when you don't have an ID. And then we talk about the language barrier, again, as a hurdle for access to healthcare services. We talked about long working hours, the physical conditions of the houses, like humidity, so many people living together, and the inability to continue education was a very, very strong sub-message, because young people wanted to continue their education and set a life for themselves. And then marriage at early age was voiced out as a problem by the male participants of the project. That was very valuable, because this actually is a problem for their peer female friends. And they also talked about discrimination a lot. And when it comes to psychological health, without surprises, of course, they talked about being away from their loved ones, trying to set up a life, the feeling of loneliness, and trying to cope with stress, all at the same time were voiced out. And sometimes, because of the inability to cope with these stresses, things evolve into substance abuse. So they talked about substance abuse as a result of these problems, and the disability of some of the family members of some of the participants was a problem. They talked about their efforts and their struggle regarding that. And of course, there was the topic of suicide that deeply affected us in our focus group meetings. And some of the participants themselves, they said they thought of committing suicide. So I think these were really important themes to hear the voices of the young people. So this health technology will be helpful for them to tackle these issues, to raise their voices, to speak up, and to guide them in their lives as a tool. So we are very excited to be able to do that. And that's why thank you very much for your time and for listening to the outcomes or outputs of this project. And now I think I will give the floor to one of my teammates who has been there since the beginning of this journey, Ilyas. Ilyas, he will be talking about his own experience. Thank you, Professor. First, let me introduce myself. My name is Ilyas Çevket. I'm a medical student. As a medical student, it was a great pleasure for me to have this opportunity to work with my professors in this important project. I also would like to thank my teammates for this. My first experience was in Haseki Training and Research Hospital when I started the faculty. I was together with my professors in the hospital, and that hospital is one of the first hospitals that admitted migrants in Turkey as a health institution. So I witnessed firsthand that there were people who weren't able to read the signs or the texts, they don't know the procedures. But what really deeply impacted me the most was that there was this woman, and she was desperately trying to explain the problem with her baby in Arabic. And the Turkish doctors wouldn't understand her, and they wouldn't be able to find an interpreter, only if a volunteer would come up from the patients themselves, they would be able to communicate. So I took photos of all these things, and I was able to express all these incidents through photos. It is really very sentimental for me. It's a very good project, and I hope it will have also very nice implications. That's it, basically. That's all I wanted to say. Maybe this was a very brief speech, but I think it was very precise, because the important thing was to express my opinion. Yes, Ilyas was one of the most loyal volunteers and teammates of the project, and he really made a great effort. So we would like to thank him. He was present at all stages.
Ben de ekip arkadaşlarıma da teşekkürünü herkes.
I also would like to thank my team members, because everyone made great contributions, both on the field or at the studio. They contributed a lot, and I was able to get to know very nice people, very beautiful people. This has really been a great project. I'm so happy to be a part of this project.
Benim sözüm bu kadar.
That's all I wanted to say. Thank you.
Thank you, Ilyas, for everything you've shared. All throughout the project, you never left us alone, and you shared your feelings and efforts openly with us. So as a researcher of this project, and also as a participant with my photographs, I feel I have the responsibility to be the voice of my other friends as well, those who have exams, those who have work who couldn't participate. I feel I'm responsible to make their voices heard as well. And I actually want to share my feelings. If you ask me what I learned the most, what I became aware of the most, it was the fact that youth, despite their differences of geography, culture, language, they all have common problems. And under the common roof created by these common problems, it is possible to come together with tolerance without prejudice against each other. And I felt that youth are more able to do this compared to adults. And we really created very friendly relationships throughout this process. That's one thing I'd like to state. And one of the greatest problems the youth is experiencing, it has been emphasized already, but it's future concerns and the ambiguity of the future. I mean, we're still living in a world where there are wars. The climate crisis is at the door. We are aware of the racism that is increasing lately, and we are also going through this process of this pandemic. So we really have ambiguous situations before us. And this really motivated us to do something together in this process. And of course, health is part of this context. It's inseparable. So that's why I think this project's output could be related to this. I mean, handling health together with this context and being able to provide youth-friendly health services is important. I believe this project will lead the way for that. And that was what motivated me the most in terms of taking part in this project. Both Photovoice and all other activities of REACH have always been youth projects from beginning to end, and I am one of the first witnesses of this as a researcher. Process enabled us to create very nice bonds, and it enabled us to share our common problems. And as I said, I feel the responsibility to be their voice as well. So I'd like to thank all of them, and I'd like to thank everyone who put effort into this project. And I'd like to thank all participants for listening to this and finding this as something listenable and sparing time for us here today. Thank you. Yes, Damla, let me take over once again. So, I mean, my heart is filled with joy. I felt very emotional with each one of you. I felt the different tones of emotions with each one of you. With Özge, we have been working for 20 years when she was a medical student at Cerrahpaşa since then. And now, together with Damla and Ilyas, we are able to continue this process. And this is an amazing feeling for me. I'm really happy to have you with us, and I'm very proud of you. And what is revealed after all of our speakers' speeches is that this is an action research, and action research is enabling the target group of the research to be at the center of this research. So this entire research is planned together with the target group of the research. And another dimension of having an action research is that it is not done just to create some findings. The research process itself is a transformation process. So since day one of the research, everyone who has taken part in the research and the people around the participants of the research have been transforming step by step, right, Damla? Yes, and we all transformed step by step since the beginning, and we transformed each other as well. We learned a lot, and we will continue to learn more. So this was something that I wanted to emphasize that I believe comes to the forefront. And secondly, Damla stated it very clearly. Being a young person is a phenomenon in itself. I mean, where you live, what your nationality is, it makes a difference only to a certain extent. Being a young person is a phenomenon on its own. And when we talk about health and when it comes to the psychosocial dimension of health, we can really see differences between groups. So being a young person is hard, but living in another country as refugee youth is even harder. Being a student is hard, being an employee is hard, being unemployed has other problems. So there is a huge variety of problems. So that's why we need multi-layered solutions. Of course, this project cannot take on the role of being a solution to all of these problems that we listed, but I frankly believe that this project will be a very important milestone on this journey, and hopefully it will be able to move other milestones on its way. So I won't take up much more time, and maybe we can have a look at the questions and contributions coming from the Q&A section. And by the way, dear participants, you can ask your questions in English or Turkish in the Q&A section, or if you want to make any contributions, please go ahead and do so. And we will start off by discussing the questions. Nurettin Özdener, a public health colleague, sent his nice wishes and asked a question. He says, can we use the Photovoice method with the people who are suffering from mental health problems at the community mental health centers? So maybe we can address this question to İnanç and Özge. As you know, the community health centers are providing services to people with chronic mental illnesses, outpatient treatment. Thank you. Well, Photovoice is possible to be used with all groups. When we look at the examples in the literature as well, with young people, with the elderly, with people with certain physical disabilities, men, women.
Çalışma konunuza ya da dikkat çekmek istediğiniz savunuculuk
So, I mean, whichever area you want to conduct your research in, or whichever area you want to carry out some advocacy activities in, you can use Photovoice. In Hatay, I had the chance to work with refugee youth, and also in Ankara, again, in collaboration with the municipalities, we worked with people with disabilities, both physical and also visually impaired individuals were in the group that we worked with. And our topic at that time was people with a certain disability, once they walk outside their doorstep, what kind of problems do they face in daily life in terms of commuting, public transport, and our visually impaired participants had taken photos at that time, even, for example. So the Photovoice activity has no limits. And I think working together with photography artists really enriches this process. And it also creates some learning exchanges, mutual learning. So it's possible to work with all sorts of participants. Thank you very much, Özge. Inanç, would you like to add anything? I completely agree with Özge. Maybe I can just underline two things. One is people who have mental health problems becoming the subject of the research rather than the object of the research is important. And, they can be encouraged to resolve their own problems. I think that's very important. And I think the community mental health centers have space there as well. I mean, I know that they have some photography activities in terms of the hobby activities they provide. So maybe adding photo voice-based advocacy into these hobby activities could create a new perspective. I think it would be very valuable. Yes, thank you very much. You both emphasized very important parts. And recently, the limitations of scientific research are really becoming more flexible, and research methods are evolving into very different areas. Inanç said this is the meeting of science and arts. Yes, that's true. And it seems that visuals are taking more and more part in scientific research, and depicting problems visually, we know, is very important. So photo voice, beyond any regular research method, it can contribute to visualizing the problems. And Inanç,
araştırma yönteminin adını bir an yapamadım.
Talked about action research, and he focused on the importance of this, and as he emphasized that the target groups become the subject of the research itself. Now, another question. One of our participants is saying sometimes there are some hostile approaches towards refugees. How did you resolve this issue throughout your studies? And thank you for your efforts. You have done great projects. So Inanç, would you want to respond, or? Well, actually we were lucky. Definitely there is such a discrimination, but I think we were lucky because of our stakeholders, because the Biriz Association, as Özlem Mumcuoğlu mentioned it as well, worked together with 15 NGOs under the roof of the combined NGOs activity they have. So we were able to come together with the refugees that were coming to these NGOs, and institutionally the doors were open to us, so we were lucky. And in terms of the refugees in Turkey, in terms of the youth in Turkey, we worked together with youth from Istanbul University and Koç University, and they were people who were already familiar with this. They didn't have too many prejudices against them. And going to Dolapdere with Istanbul University and Koç University students really created a difference in their perspectives as well. Maybe it broke through some of the prejudices they had. So the project had some upsides. So we had institutional support, and the location was very helpful. Özge might want to add. There may be some background noise. No, don't worry, there is no background voice. Well, yes, definitely it is very important, discrimination against these people and stigmatizing them. And as part of our project, we also wanted to minimize this stigmatization and prejudice, and we wanted to raise awareness in this sense. And our work groups consisted of mixed youth, so both local and refugee youth came together, and we had a group of multidisciplinary youth from medical to public health to other areas, and they became familiar with the problems of one another. And I'm sure that these acquaintances will be beneficial for them in their professional lives as well. And I believe working together also helped them overcome their prejudices against one another. Okay, another question. You talked about reproductive health as well. Can you further expand on this? I work for refugees. I'm a social worker, and crowded families are observed the most because of cultural norms. Contraception methods are not very well known, or they don't have very positive views about contraception. So what kind of an approach does the youth have against this? Olur. I think Özge is starting. Well, actually, in our working method, especially, we didn't focus on any specific questions. I mean, it was really free, and at times during the discussions, reproductive health also came up. And of course, our main purpose was to focus on all topics on our digital app, including birth control methods and reproductive health. So reproductive health, yes, it is definitely an issue that is important for both refugee and local youth, and information is usually gathered through various sources, and there can be some misleading information or lack of information. Of course, there are cultural norms involved as well in terms of reproductive health and sexual health, but we believe that talking about this is important, and access to correct information is very important. So including the surveys and all our activities throughout this research, and we combine this with the discussions we have with the professionals as well, and we mapped out where they can receive assistance in terms of reproductive health as well in this app. So this is one of the topics that we really want to focus on. Thank you, Özge. Inanç, do you want to add anything? Yes, please. Actually, as our participant has mentioned, it is not very easy for young people to discuss this, or it's not something that comes up primarily. So we had to kind of dig into reach these topics when we talked about siblings' marriage or relatives' marriage. At that point, we started asking them about how they access sexual health information. And of course, there's embarrassment around the table. People start looking down towards the floor. They can't make eye contact. You see all those emotions around the table. But once you start to kind of create humor around the issue, then you start to notice that information about reproductive health or sexual health is things they get from their peers, really, or internet-based information. But there isn't really any filtering about whether or not the information they are receiving is accurate. So that's why being able to talk about this and making it more visible is important. And another finding was that women being forced to marry at a young age created some challenges in terms of being a mother and being a young woman at the same time, and being able to satisfy the husband, taking care of their physical appearance, and also stopping milking at a very, very early stage because they're worried about their physical appearance, for example, was something that came up. So through our digging into this issue deeper, these were the findings that we got from our participants. Thank you very much, Damla. And İlyas, if you want to contribute, we can hear from you as well. Well, I actually completely agree with İnanç. We experienced this process together, and as she has also mentioned, these aren't topics that easily come up, especially female participants, which they were lower in number anyway. But when these topics came up, they would talk with a lower voice and kind of in a small group, and they would be looking down onto the table. And they started speaking in Arabic among themselves as little female group there, so we couldn't really understand what they were saying. But this is definitely a need. There's a need for accurate information sources in this area. Thank you very much. İlyas, would you like to contribute? I think İlyas is having connection problems. Okay, then let's look at another few questions, and then I'll hand over to Yanis for closing. So there's another question. What kind of differences or similarities were shared between Syrian and Turkish youth in terms of health and healthcare access problems? Maybe İnanç could start, and then I could add on to that. Well, maybe we can respond to this question from where Damla started off. I guess at the end of all these discussions, we saw that there is no difference between being Syrian or Turkish when you're youth. They had quite common points in terms of future concerns. For example, in Turkey, when you look at it, Istanbul University and Koç University could look like advantageous or privileged universities, but when you look at their future concerns, it seems the students from these universities are having quite similar future concerns compared to the Syrian youth. So these are the first things that come to my mind. I don't think there are very specific similarities or differences really, but maybe Özge and Damla may add. I may not be able to give the floor because our time is almost up, but I think your response was comprehensive enough. So there is something that I would like to emphasize. This project was targeting both local and refugee youth. I think that was a very good thing to do because that created these results. I will read one final question and then I will end this Q&A session. So we have a participant from the US asking this question. Why is it that using the Photovoice method has positive psychosocial impacts on the participants? I mean, why do you think it turns the process into a more positive experience? And if that is the case, can these impacts be repeated in other settings? What could be the potential mechanisms? So basically, it's a method-related question. Who would like to respond to this question? İnanç and Özge? Well, very briefly, I might want to say this. Based on the 3-4 Photovoice activities I took part in. First of all, photograph really enhances the impression, the expression. I mean, sometimes when participants are taking the photos, they may face certain realities that they weren't really very aware of, or they are better able to express themselves. And photo and sound comes together with Photovoice. That's what we mean. And when they're talking about the photos, again, you can state the things that you are not able to verbally through the photos. And another benefit is the photos are also a great tool in terms of advocacy, because instead of writing pages long of reports, instead you are able to reach the decision makers through your photographs. So the participants, the researchers, everyone is able to have stronger communication over the photographs. That's what I think. Okay. Thank you very much. İnanç, İlyas, would you like to add anything because you all experienced this process? I could talk about my own experience. Expressing your experience through photographs also pushes you to become aware of your experiences. Sometimes when you see a road sign or a poster about health information, I mean, when you start looking around through that perspective, you start getting the feeling, okay, this is the problem I have and I need to express this. And taking those photographs, sharing it with your peers, it creates a very appropriate setting. And you also feel that through these sharings, you are experiencing a common problem with many others. So that was the feeling for me. It raised my awareness, and it really felt that my problems weren't individual, they were common problems. Okay, Damla, I think you expressed it really well. I don't think we need any more evidence. So in these last 5 minutes, yes, there are a few more questions, but I would like to apologize in the favor of time. I just want to briefly explain, because there was a participant who asked about more information about those photos. You can check the website and there will be links shared with you. So continue to watch us, continue to follow us, and you will be able to reach further information about these photographs. I would like to thank all our panelists also for abiding by the time and also for their very fulfilling answers to these questions. And now for closing, I would like to leave the floor to Yanis.
Thank you, Professor Karabey. Thank you for being a wonderful moderator, as always. So we are already at the end of this great event. And first, I want to thank all of the panelists, like Professor Karabey just did, for your great contributions. I also, again, want to thank all of the partners. Without you, this project would not have been possible. So we look forward to continuing and being able to bring, the reach impact to many more people, hopefully. And then finally, of course, I want to also thank everybody who was able to join us online. We hope that this format was good for you and that you were able to get something out of it. So let me take the last 2 minutes to give you a little bit of update on what's happening next. And I want to repeat something very important that Professor Karabey said. The purpose of this research is not to produce data. Producing data is important, but what we want to do is for it to be transformative. And this is exactly what we've been focusing on for the last year and hopefully also for the years to come. We've been very busy taking all of this information. Why are refugees, migrants, and local youth not able to access health and healthcare that is there, that is available? Why can't they do it? And we'll be able to produce an application with all of the results from the research, an application that will be hopefully useful for the refugees, for the migrants, and for the local youth. So in the coming weeks, this application will be available on all of the platform. And what will they find? So first of all, good, reliable health information about physical health, about mental health, about social health, about environmental health. So the application will give them all the information that they need without having to physically go to a healthcare facility. And secondly, and very importantly, it will be able to geolocate around them the healthcare facilities where they could go, and it will also list all of the services that will have available there, and also, and very importantly, whether there is a translator. We heard, for example, that obviously language is a huge barrier, and sometimes the refugees and the migrants are not able to communicate with the local doctor what is the reason why they are there. So all of these services will be available at their fingertip on our application. And then right now, our project is in Turkey and in Lebanon. Today, the event was focusing on Turkey, but there will be a similar event that will also show the results from Lebanon. We are very happy to say that we are also going to be moving to Jordan, so we'll be expanding the reach's reach to a third country that also has many refugees and migrants from Syria. And then finally, let me say this. When the REACH project was designed over a year and a half ago, there was no COVID pandemic. And now, more than ever, with the COVID pandemic, a tool like the REACH application will be so useful for many people. And we hope that it will be used. So again, thank you for everyone who participated, and thank you for joining us to our event today.